A recent federal report ranks the healthcare at Wisconsin's rural hospitals as one of the best. News 8's Eric Jacobson got a chance to visit one of those hospitals today. He joins us with more.
Lisa, the report comes from the Federal Health Resources and Services Administration. The reports say the 58 rural critical access hospitals in Wisconsin, or hospitals with 25 beds or less, are the best in the nation. One local hospital says that ranking comes from a number of factors.
But in a critical access site like this, we're doing it all.
Dr. Mark Tummerman is a family physician at the Mayo Clinic Health System in Sparta.
In the middle of the night, in the mornings, at any time of the day, regardless of the type of problem, we don't have that specialist right at our elbow.
The federal report that highlights these hospitals as the best in the nation look at factors such as patient outcomes, but also how they communicate.
When a patient comes to a small hospital into the emergency department and then needs to be transferred to a larger hospital, there's certain information that needs to be transferred, and it needs to be transferred in a timely way.
We know that a lot of errors occur in medicine when there are barriers to safe communication.
Unlike rural hospitals across the nation, their Wisconsin counterparts are faring better when it comes to financial stability.
Our Wisconsin, even the small hospitals, they're run very well from a business perspective.
So part of our opportunity becomes reducing our cost structure by trying to reduce our unit costs. So in doing so, we have the advantage of Mayo Clinic Health System to help us do some of that work.
Rural hospitals face another challenge, recruiting staff to work in these locations. Doctors say in order to keep their ranking high, they need to find the right people to work in a rural environment.
What it comes down to is it's looking for that family physician or nurse practitioner or associate provider who is looking to practice in the community. If you're one of 100 physicians versus one of 5 physicians, it's a whole different kind of feeling.
Now, in this federal ranking, Minnesota is also ranked 4th.
Now, you mentioned that recruitment is one of the difficult pieces of this when you're talking about a rural hospital. How does the Mayo Health System in Sparta deal with this?
Well, officials there tell me that about 5% of all healthcare workers want to work in a rural setting, which really amazed me. But what they have to do in these situations is when they find someone interested in working in those settings, they need to hire them quickly because there is such a high demand for those people in those rural settings.
Yeah, jump fast. All right, thanks so much, Eric.